The federal government has assured Nigerians of its readiness to strengthen surveillance at 5 international airports in the country to prevent the spread of coronavirus. The 5 international airports are in Enugu, Lagos, Rivers, Kano, and the FCT. The Minister of Health, Dr. Osagie Ehanire, who disclosed this at a news conference in Abuja, said government would also set up an inter-multi-sectoral committee to scale up surveillance and vigilance.
The committee shall comprise of critical stakeholders in the health, security, aviation, and transport sectors, and also include development partners. Bearing in mind that air travelers, rather than land border crossers, are more likely carriers of this type of virus, attention will focus largely on our 5 international airports. A Port Health Service is currently implementing measures at these points to forestall importation of the coronavirus to Nigeria.
According to Ehanire, NCDC is currently receiving World Health Organization's advisory to countries and agencies on surveillance and response.
The ministry wishes to assure Nigerians of the capacity to detect, assess, and respond to these and other public health threats. The Nigeria Center for Disease Control, NCDC, has set up a coronavirus preparedness group and is ready to activate its incident command system for coronavirus if a suspect case emerges in Nigeria. NCD is also constantly receiving World Health Organization advisory to countries and agencies on surveillance and response.
He therefore urged airlines to comply with protocol on any passenger who took ill or looked ill on board to be reported by authorities.
The ongoing surveillance strategy at air points of entry involves automatic body temperature detection by thermal scanners, which detect any passenger with fever, and it is focused, and also there's a focused visual observation of passengers who may be showing signs and symptoms of being unwell. Where any passenger is observed to meet the slightest index of suspicion, he is politely invited to step aside for a chat, where his travel history will be obtained.
In her remarks, the Director of Port Health Services in the ministry, Dr. Morenike Alex Oko, said the ministry would further work with state governments for containment.
The states are expected to ensure social mobilization of their population, to sensitize them and make them aware, so that if any one of the community members shows symptoms, they can take the appropriate steps and go to a health facility.
Dr. Joshua Obasonya, the Director of Prevention and Program Coordination, NCDC, said that the center had been collaborating with Chinese authority in Nigeria to ensure that citizens that traveled for holiday to that country delay their coming.
I've had some discussions with the Chinese embassy also. We'll be working with the Chinese companies and the employees. And one measure that has been taken by the Chinese embassy is to send advisories to all employees that they should delay coming back to Nigeria. And we will also be working with the Chinese companies in Nigeria, working through their medical advisors in each of these companies. So